Hi, my name is Amanda. I'm a student at St. Thomas University. I'm going to be doing a respiratory system assessment. I have my patient Edna. Prior to walking in the room, we've checked vital signs. They're all within normal limits. The first step to assessing your patient would be to just observe her respiratory system based off of her respiratory rate and effort. Also, we're going to be checking for her posture just to make sure that she's sitting up straight. Her skin, there's no signs of hypoxia such as bluish grayish slips. Her skin is appropriate for ethnicity. Also, we're going to be looking for the use of accessory muscles. Okay, can you take a deep breath for me? Okay, the shoulders rise symmetrical. Next up, we're going to be palpating for crepitus, okay, which we can do just by gently using the pads of our fingers and pressing along her skin. Crepitus is a sign of subcutaneous emphysema, which is not apparent in our patient. Next up, we're going to check for fremitus. I'm going to be touching you on your back, and can you please repeat 99 for me?
99, 99, 99.
Thank you, and they're equal throughout. Next up, we're going to be checking for diaphragmatic excursion. I'm going to put my hands on your back. I'm going to ask you to take a deep breath. Thank you, and they move simultaneously and symmetrically. Next up, we're going to be percussing. And when we percuss, we're looking for resonance. Any dull sounds would be signs of pleural effusion. We'll start off and go from side to side just to compare one side to the other. Okay, so far so good. It's all within normal limits. Next up, we're going to ask our patient to take a deep breath. When she inhales, when she inhales, her diaphragm would move up, and then we would mark that area. And then we repeat the same process when she exhales, and we measure the distance in between. That would be how we assess for diaphragmatic excursion. And within a normal individual, it should be within 3 to 5 centimeters. Okay, can you take a deep breath for me? Okay, we mark that area. Okay, can you take a deep exhale for me? Okay, we measure. With her healthy individual, it's at 3 centimeters. Okay, next up is the most popular part of a respiratory system. It's when you auscultate your patient, you're looking for any adventitious sounds such as crackles, wheezing, rhonchi, or rales, which could be signs of asthma, any foreign body, as well as pleural effusion. Okay, you would repeat the process in the posterior side of the chest as well as the anterior side. Can you take a deep breath for me? In and out. In and out. Repeat it. Okay. No adventitious sounds noted. And that completes our respiratory system assessment.